So my name's Bo Bernhardt. I'm actually an associate professor in the departments of sociology and in hotel management. And on November 10th, we hosted what we called an e-health summit. And the focus here, of course, was on the intersections of technology and health. And we looked at it through specific lenses to Las Vegas by virtue of exploring the ways in which this might affect gambling. As you may have heard, gambling has moved from very large cathedral-like spaces on the Las Vegas Strip to this space and has transformed from something that's consumed in big palaces to a place that's consumed pretty much anywhere. And the health questions, of course, are what happens to people when you do this, and how might we better understand this. So we were motivated by this transformation of gambling into new spaces, and also by the transformation in communication, the revolution in communication, really, associated with the fact that everybody is linked via cell phone. We have 5 billion cell phones on a planet of 7 billion people. We will reach 1 billion smartphones, that is connected to the internet, next year, and the anticipation is that that will move even more quickly, which effectively connects the world's knowledge to the world, which becomes pretty transformative when you think about it. So in thinking about communication and thinking about where the kids hang out these days, right, in our classes, they're all texting and looking things up online, we wanted to sort of explore the impacts and potentially some solutions. So we invited a handful of trusted souls from around the world, really, to speak with us. The first gentleman who presented at the eHealth Summit was Jeffrey Derevensky. Jeffrey Derevensky is the world-renowned leader in the field of studying the impacts of gambling with younger populations. The McGill University psychology department has an entire program devoted to this area of study, and he really wanted to explore and sort of set the stage for us on how these new technologies are affecting young people relative to their gambling behaviors. And he noted that when you look at slots for adults and slots for kids, there are some pretty striking similarities. On the left is a Chuck E. Cheese-like place in Canada. On the right is, of course, an actual gambling hall. The machines are largely the same. The prizes are set up differently, and therefore they can avoid the law enforcement folks out there in Ontario. This, once more, a scene with a handful of children in Canada. This is a scene in England, actually, at some of the fruit machines they have there. These are a little bit more of a close-up of some of the fruit machines. He told stories, of course, of a lot of parents in this season giving lottery cards to their children in their stockings as presents, and this being sort of a widespread embrace of the gambling act that we've seen with the adult population, but we may not have thought about as much with children. He then took us around the world. This is actually a playground in Macau, which looks fairly innocuous until you take a closer look at the roulette wheel on the playground. So we're certainly not alone in North America when we look at the sorts of ways that this has penetrated children's consciousness. He's done a number of prevalence studies, and a number of his colleagues have done prevalence studies that establish sort of the rates of pathological gambling among youth. And this is one of the few populations where we've seen significantly higher prevalence rates than we've seen with the general public. The general public rates run at about 1% to 2%, depending upon your measurements. But with youth, we consistently see numbers of 3%, 4%, 6% in Canada, 3 to 5% with the National Research Council in the United States, and almost 6% in the UK, with a 9% figure in a study in Scotland. So this is clearly an at-risk group. One of the things, and this was where I was getting educated during the eHealth day, was he started to look at the popular Facebook fan sites. And I knew some of these. I'd heard of Eminem, I'd heard of Vin Diesel, I'd heard of the Lady Gaga. But any guesses on Michael Jackson's number 2? What's the number 1 most popular Facebook fan site on the planet? I mean, given where we're headed, it might be somewhat obvious, but the number 1 most popular Facebook, against the backdrop of the Michael Jacksons and the Lady Gagas, is Texas Hold'em Poker. The number 1 fan site in the Facebook world, which is, again, where the kids live these days, right? And indeed, the grown-up kids among us as well. So we moved then to my friend and colleague, Debbie LaPlante at Harvard Medical School. And I should say that Debbie is a co-principal investigator in this Lincy project. It was a really nice moment to get to sort of join forces with UNLV and Harvard Medical School to develop this particular grant. And she took a step back, actually sort of a sociological step back, to look at broader issues of whether technology can hurt or help public health. And as a sociologist, this really resonated with me. And it was interesting to see Debbie, who's very much trained as a medical professor, looking at these issues through a very sociological and anthropological lens, even a historical one. Historians note that with each advance, society has been haunted by the effects of technology on the individual and society as a whole. In other words, it's been for many, many years we've been worried about the next this. And a primary concern is included whether the new technology will be overwhelmingly attractive to new populations who are exposed to it. Medieval society, Debbie noted, had an ambivalent relationship with the development of mechanical clocks. Seems crazy to fear clocks, but the concern here was this had a unique ability to redirect individuals' attention from eternity and spirituality to the present and sort of distract us from the important things to focus on the less important, right? Once more, the parallels with our fears today are quite clear. Much later, electronic communication advances in television and radio stimulated concerns that these devices would absorb individuals' time or cause addiction or other scandalous behaviors. Most of the research on these sorts of new technologies, however, suggests that the effects are fairly temporary. But more recently, people have expressed the same concern about excessive involvement with personal computers, the internet, mobile devices, smartphones, and of course gambling in those environments. And the way that she explained this, and here I am, a sociologist trying to deliver a speech that is more ably presented by a medical school professor, is that a key component of the development of addictive behavior, of course, happens in the brain, and it involves the activation of the brain's reward system. The reward system in the brain teaches us to do things that feel good, things like drugs, things like sex, things like gambling can, of course, stimulate, activate this part of the brain. And the thinking for many years was, well, this can't happen with gambling addiction, right? Because you can't shoot video poker, right? You can't snort a deck of cards, not without significant amounts of pain. How, if you can't ingest the product, can you get addicted to the product? Well, with this new understanding of sort of addiction as a syndrome, where you get sort of addicted to the place that you go more than you get addicted to the thing itself, has sort of redirected our attention to a new type of addiction that's enabled by this understanding. So Debbie then turned her attention to internet gaming and looked at similar brain activation to those of individuals who are have substance dependencies or pathological gambling. And this is with people who are just playing games like the Zynga games, like the non-gambling games. And again, her concern is, and society's recurring concern, is that this just sort of reflects one side of the story of technology and addiction, and that technology might also play an important role in preventing or curtailing risky behavior. So Debbie's done a couple of things with this presentation. She's looked at in a much more detailed fashion over the course of an all-day e-health summit held over at the Fulton Building. She's looked at the data and looked at the ways in which there's a novelty effect. And one of the analogies she used that was really useful for me, as somebody who has a 2-year-old at home, is that it's kind of, it might be well understood as the new toy effect. You give a kid a new toy and the kid loves the toy for about 2 weeks, right? The novelty wears off. The kid isn't engaged in excessive playing with that particular toy soon after that period. Well, it appears to be the same with a lot of different new sorts of technological substances, if you will, where you see sort of spikes in both prevalence and pathological prevalence that then fades after a while. We've seen this with gambling in the field that we were studying. In new jurisdictions where gambling is introduced, you do indeed see a spike, an increase in new gamblers in Detroit when gambling is introduced in Detroit. In Pennsylvania, when it was recently introduced in Pennsylvania. You also see spikes in pathological gambling, but fairly soon after, it returns to sort of a new normal as we look for the next new thing. So this constant pursuit of newness is something that might well be biologically wired, she argues, and she also argues that technology is something we've long feared, and that maybe we should look at solutions as well as problems. So that led us to our presentation, and Debbie and I put this together on what we call e-health, and what a lot of researchers have called e-health. Clinical researchers have suggested the ability to use computers to treat behavioral disorders might prove to be a small revolution in the delivery of mental health care. Now, not a substitute for conventional mental health care, but we do know that a very small percentage of people who suffer from, for example, pathological gambling ever end up in our mental health safety nets. These are populations that we just aren't reaching for a variety of different reasons. And so most of the prevalence research that also looks at the prevalence of individuals who suffer from pathological gambling who show up at a treatment center shows that this is a very, very small number. So why not try to reach out in other ways via complementary tools? That's what got us started thinking about what we've called healthy gambling. So this is the healthy gambling part of the presentation. This is where I got up and we talked about the ways in which we've transformed a program that used to be on the internet into this environment, an app environment. And the Lincy support actually allowed us some bridge funding to get to a private foundation that's now going to be supporting this as an app, because after all, this is, again, where the kids live these days, and we were so 2007 when we were putting our website together, right? But the website itself focuses on ways in which, once more, technology, maybe just maybe, can help some people with some of these problems. So my broader argument, as I've alluded to already as a sociologist, is that we're transforming, this is to use George Ritzer's famous phrase, from cathedrals of consumption in spheres like movie theaters to consuming the movie in a much smaller environment, right? In this case, a man cave, I've been told, is the phrase that we're to use for an environment like this nowadays. And then increasingly beyond this sort of home theater environment, we watch them here, right? Well, one of the fears for the future of Las Vegas revolves around the concern that this might transform into this. And once you can consume this truly in your pocket, on your person at all times, in an increasingly compelling environment, what does this mean for Ritzer's cathedrals of gambling consumption? Will we see a trajectory similar to that of the movie theater, whereas it used to be that 2,000 people got all dressed up and went out together to consume their favorite movie? Nowadays, that's just not the environment that this product is consumed in anymore. And so this led to the development of this product. And one of the things we were interested in doing with Lincy was sort of putting the word out on the eHealth project. And our friend Dr. Drew Pinsky in California. This is actually on Black Friday. Black Friday was April 15th this year. It fell on tax day. Was the day that the internet gaming world shut down. The feds went after Party Poker, Full Tilt, among others, and closed down a thriving, flourishing internet gambling industry. And they brought us on to talk about, among other things, whether this will in fact curb an epidemic. And so, when you're on these sorts of shows and there are these, soundbite-oriented television programs, the desire is to seek the spectacular, right? That's the media bias. It's not necessarily always conservative or liberal so much as it's for the spectacular. And so the questions that we were being asked on that day was, is this putting a halt to what would become an epidemic in problematic gambling behavior? And of course, there are a number of points to be made here. One of them is gambling finds a way historically. There's a horrible line in a horrible Michael Crichton novel, Jurassic Park, where the scientist gets up at the end and talks about how the dinosaurs have taken over the world, and he says this is because life finds a way. Well, so too does gambling tend to find a way historically. One of the reasons why Singapore legalized gambling was because they found gambling sprouting up in odd places like funerals. Funerals in Singapore were gambling sites because they knew that the police wouldn't dare bother a funeral, so sacred was that gathering. But the gambling itch needed to be scratched, so to speak, in that environment, in that way. And so it's interesting to sort of see how this manifests depending upon who's trying to stamp it out. So we talked on this show about not only the sort of consistency of the appeal of gambling, but also of the promising technologies that might help in these environments as well. Again, if you can gamble in these environments, maybe you can help people in these environments as well. So this is based on a long literature review that I won't bore you with, but we studied a number of different interventions with e-tools and e-health approaches. We found that there are all sorts of positive outcomes with things like diabetes, with things like weight loss, with things like smoking cessation, with things like alcohol abuse, and with younger populations, again, who live in a smartphone world, who might be a little bit more attentive to an intervention in that sort of environment. And when you think about it, it sort of makes sense because you always have this tool on you in the smartphone. It can remind you of things. It can track consumption. And soon it's about to get much easier, right? You've heard about this, about how your smartphone soon will be able to talk to your refrigerator, know that you're out of milk, and then when you're at the Albertsons on the next day, it will be able to give you milk or let you know that you need milk, right? The devices are starting to talk to each other and in rapid fashion. We're not too far off from this being able to talk directly to the slot machine you're sitting in front of, and this therefore becoming a pretty accurate tracking device. Tracking, monitoring gambling behavior has been a really tricky thing in my field, in my research field, because gamblers are notoriously poor with recall. If you're to ask people at McCarran Airport, right, how'd you do this weekend in Las Vegas? They'll say, I was up Friday, I lost big. Saturday, Sunday, I was about even. Well, no, you weren't, right? Now, we wouldn't have constructed these monuments to math that are the cathedrals of gambling consumption if that had been the case. So we've relied for many, many years upon recall, which is really, really bad in our line of work, in our field. This isn't bad at that, right? This tracks down to the millisecond, down to the penny, your consumption. And in many ways, what the Harvard Medical School folks are arguing is that it actually allows us access to understanding addictive behaviors in a way that wasn't actually available to us prior to internet gaming. So maybe internet gambling won't be, not only will it not be the end of, of all gambling things and just this horrible epidemic, it might actually open new doors to new types of understanding. So it's a little more optimistic way of looking at these sorts of things. So given all these successes in these other fields, we decided to create an e-health program. Now these are the 4 areas, and if you're interested in a demonstration, we can give you the website. It's at divisiononaddictions.org. That's the Harvard Medical School website, /healthy gambling. And these are the 4 areas that we have on the apps and on the websites. We have educational messaging, because after all, it sounds pretty boring, but education a pretty important component of healthcare. After all, doctor sits on your bed after a cancer diagnosis. And the first thing that she does is she tells you, here's what we know about cancer. Here's what we know about what your body's been through. Here's what the research says about what you have. The educational moment remains an important one. The media might be shifting, though, right? The ways in which we transmit these messages might be shifting. A resource finder. One of the nice things about this, equipped with a GPS. So you're in here listening to a boring lecture from an awful sociology professor, and you think to yourself, man, I've got a gambling urge. I got to go. I got to get out of here. I got to go play. What you can do with this is find the nearest next Gamblers Anonymous meeting, which might happen to be at the University United Methodist Church across the street on Maryland Parkway here in 15 minutes, right? By virtue of inputting the 100 Gamblers Anonymous meetings into this, coupling that with the GPS technology, we provide a powerful new tool, that didn't exist prior to these devices. So once more, we're not naive optimists, but there's reason for optimism here in using these technologies. There's also a community finder component where you can connect with other people, real people, or a virtual sponsor, which is sort of a choose your own adventure, remember those books, sort of thing. It's a decision tree. It's in beta testing, but it's very interesting. The virtual sponsor sort of plays off of the traditional sponsor in 12-step environments and certainly is not designed to replace it. But can Siri-like the Siri voice on the new iPhones, respond in interesting ways and hopefully helpful ways in guiding you to different resources if you have certain types of questions. And so once more, none of this is designed to be a replacement for conventional mental health treatment. All of it, the spirit of all of it, is to be in fact complementary and to maybe reach new people in new places, maybe not purely pathological people after all. This isn't going to treat somebody who's hurting in a very severe fashion, but maybe it could help some people who are a little bit less severe, a little bit further up on their downward spiral. Down the road, one of the things we're working on are algorithms. Again, because you have precision with gambling behavior in a way you never have had before, now that you have everything measured to the millisecond and to the penny, you don't have this in alcohol studies. You don't have this in drug abuse. The hope is, maybe, through minds much smarter than mine, algorithms can be developed to start to track patterns of risky behavior and once more, be able to intervene earlier and more effectively in a way that's more research-based, that's enabled by not only gambling and the uniqueness of the Gambling Act, but also the uniqueness of the technologies. So we focus grouped this. That was one of the things we did with the kids here at UNLV. We also did this in Medford, Massachusetts, or in urban Boston, and North Brookfield, Massachusetts, in rural Massachusetts. And we found a couple things. Simplify, simplify, simplify. Our tendency as professors to talk and talk and talk, right? Not a good tendency in this environment. And the tools were effective, but they wanted it to be more fun, more effective. And as teachers, we always hear this from our students, and we almost resent this, right? All our students want to be as entertained. And we can go one of two ways. We can resent them for this, or we can try to meet them where they live, right? And so I suppose it gets back to a sort of pedagogical debate that we don't have time for here. But that was the feedback we got on that. Make the text less academic. Again, we got that over and over. We're guilty. Enhance the individual customization features so that when you go on to this app or this website, it becomes something where they say, hey, Bo, you've gambled $42 since your last visit. You had said this month you only want to lose $100. Do you want to, do you want to set a budget that ensures that you keep to that limit, and those sorts of customization features, which we've since added. The other thing that I didn't do that we've since done, and I swore as a Las Vegas researcher I would never do another research project without translating it into Spanish, and then I did this in totally in English and only in English. We've since translated this into 6 languages. And it's, we got a small grant through a European entity to translate it into 6 languages that are prominent in the European online gambling environment. So we've listened to that focus group feedback as well. The last presentation blew my mind. And this was where we sort of took a chance, because Phil Polgreen was somebody I'd heard on NPR talking about using Twitter and using it to diagnose, using Twitter to promote health, using Twitter in ways that medical school professors hadn't really done before. So we blew our Lincy budget on this guy. We said, we fly you out here for the lunch keynote, the sort of grand finale here. And this was spectacular. I've never been in a room, and I should back up and say that the room was, we had 50 invite-only attendees. We had people in this room, great UNLV attendance. Tremendous participation by the local health community, by the local technology community, Link 360, and all of those folks from the Summerlin technology offices were here, and on and on and on. UMC was here. It was really an impressive and diverse group of stakeholders. I've never heard a more diverse group of stakeholders, many of whom are non-researchers, be so awed by a handful of graphs that I'm about to show you. Here's what Phil Polgreen does. He uses Twitter to fight the flu. As somebody who's suffering from the flu, you might hear this in my own voice. This is fascinating to me on a number of different levels. So flu you don't think about much, right? But it causes tremendous numbers of deaths, a lot of hospitalizations, tons of money in healthcare is spent on this, and associated with all sorts of other problems, and really increases utilization of healthcare resources, in many cases inappropriate uses. And historically, it's been a really tough thing to track. We sort of, after the fact, chased the flu and had a really difficult time. It's been very unpredictable, the flu, and trying to figure out where it is and where we should go in terms of devoting medicine, devoting medical resources and so forth. And the data was really, really tough to track. A lot of it ended up in emergency rooms, but again, our analysis happened after the fact, and this has really been something that's plagued the medical community for many, many years. If you could be better at forecasting the flu, you'd have extra time for administering medications, for vaccinating high-risk individuals, for preparing for increased numbers of patients, visits to emergency rooms, for school closures and those sorts of things. There are a lot of benefits that could come from figuring out the flu. It's tough, though, because the information's disparate, it's expensive to collect, it's found in all sorts of forms and formats. In many cases, it's private, it's not in the public domain, or people just don't show up. I've not shown up with this cold I have right now, whatever it is I have right now, in any of the medical community's databases, because I haven't showed up for any of them, right? I've bought Theraflu, I've purchased Theraflu, so if there was some way to figure that out, they would identify me. But it's, as you can see, a very tough thing to pull off. But then there's Twitter. Here's the amazing thing about Twitter. Everybody's writing down what's happening to them all the time. And again, this is something that was alien to me. I'm not on Twitter, I'm not a tweeter, I'm not I don't do what the kids are doing these days in so many ways, and yet I'm fascinated by this. But people are sharing tons of information and saying things like, I'm home from Andrea's in church, I'm so tired, I feel sick. I can't get sick. The Harry Potter premiere is coming up, I can't be sick. Got to go down some meds, right? Good morning, and this is actually something where there's some international languages as well, some that are where this is conveyed, and they're translating things as well. But the message here is that you can learn a lot from Twitter, and there's a ton of publicly available data that's crunchable. So it turns out that Twitter's much better than Google searches at figuring out who's going to win an American Idol, which again is something I know zero about. But it's a pretty impressive trend. When you look at the predictions of Google and compare it to the predictions of Twitter, Twitter actually much more accurate. But tweets are often messy. A lot of them aren't in English, using different formats, out of the US, spam, a lot of jargon, right? And so they've developed some artificial intelligence to sort of sift through all of this, to deal with the misspellings, flu, F-L-U-E, coughed, C-O-U-G-F, G-H-T. And so they tried to work with this as well, and they used techniques that I won't even pretend to understand to sort of sift through all of this. They then tracked only tweets connecting words correlated with influenza. And then they started to sample some of the tweets, but again, the noise sort of gets overwhelming with all of the tweets happening all of the time. This is more information on the methodology, once more, in a way that I couldn't possibly explain to you. However, I think it's interesting to look at sort of how they use these highly correlated terms and stems to sort of track where this was happening in which parts of the world. And here's one of the first amazing graphs. So here is the reported flu over a series of months and the predicted by Twitter pattern. The orange is the predicted by Twitter. The blue is the actual flu observation rates in the United States. Needless to say, a massive improvement, as he was showing us previous ways of doing this, over how we used to do this in the past. So they tried to get a little bit more geolocated. And it turns out that people are starting to use their location. I'm Bill Lee, and I'm in Park City, Utah. And you can really start to identify where people come from their tweets. So they then focused last winter on New York and New Jersey. And once again, the reported incidences of the flu and the predicted incidences of the flu, again, it doesn't really matter because they track so perfectly, but the blue is the actual, the orange is the predicted by digging through 60 million tweets and looking for all these different stems and finding out who's sick and where and when. That's where it gets you. And it's kind of a remarkable moment in human history when you think about it that way, because everybody's reporting on stuff. And huge privacy concerns here, right? I mean, this is part of the debate. This was certainly part of the conversation during the eHealth Summit we had over across campus. Because this is a little scary on some levels. This is something that can be tracked, certainly in the aggregate, but might also lead to privacy concerns on a more individual or aggregate level as well. So it was a fun day. It was a day that we got to play host thanks to the generosity of the Lincy Foundation, where we got a chance to host folks from Harvard Medical School, from McGill University, from the University of Iowa. We had UMC speakers come up and talk about how technology is being incorporated in Southern Nevada today. We had all sorts of hopes expressed for continued coalition work that we're interested in talking with the Lincy folks about continuing to do over time. But that is, in a nutshell, what we did last November 10th, thanks to the generosity of the Lincy Institute. So thanks very much, and thanks for putting up with my own congestion and poor health. Thank you.